Have you heard of Lactobacillus before? It's a useful bacteria present in the gut and the female reproductive tract. This is the same bacteria actually that's present in yogurt and is considered a probiotic because it promotes health benefits. In the vagina, Lactobacillus should be dominant at 80% or more. This Lactobacillus will produce lactic acid that lowers the vaginal pH and suppresses the growth of bacteria, viruses, and also yeasts, which could cause problems. If you are someone who's suffered with either infertility or recurrent miscarriage, then one thing to consider checking is your vaginal microbiome. The microbiome refers to all the different bacteria, fungi, viruses, and also tiny little microorganisms living both on and inside our bodies. There are some microorganisms that are meant to be there to prevent unfavorable organisms from growing. At first, much of the focus was on the gut microbiome and how it can affect the gastrointestinal tract. But evidence suggests that the reproductive system microbiome is also important to consider. Achieving the balance between beneficial and harmful bacteria is crucial. Dysbiosis, where there is overgrowth of harmful bacteria, may affect gynecological health and fertility without producing any obvious symptoms. According to the Center for Disease Control, the CDC, 84% of women with dysbiosis exhibit no symptoms. There is a growing body of evidence suggesting that good vaginal microbiome composition, or eubiosis, is more favorable for achieving pregnancy and reducing the rates of preterm birth, pelvic inflammatory disease, premature rupture of membranes, and also miscarriage. Recently, there's been a growing interest in studying how the microbiome isn't just connected to specific health issues, but also has broader effects like affecting the immune system, hormone levels, and even mental well-being. Various factors can influence the composition of the vaginal microbiome, which is constantly fluctuating. These include environmental conditions, such as antibiotics, taking contraception, or pre- and probiotics. Lifestyle factors, such as hygiene and sexual habits, also play a role. Vaginal douching and using sexual lubricants with glucose can favor dysbiosis to occur, so these should be avoided. Bacterial vaginosis is a well-established dysbiosis where there is an overgrowth of certain unfavorable species, such as Gardnerella vaginalis, Prevotella, and other anaerobic bacteria. Bacterial vaginosis can cause vaginal soreness and a vaginal discharge with fishy odor, but it has also been linked to more serious problems, such as recurrent miscarriage and preterm labor too. The overall aim of treatment is to manipulate the microbiome into a more favorable state to improve the health and fertility of the woman. However, the ideal composition is still unknown, as understanding the intimate connection between the microbiome and fertility is still evolving. More research is essential to improve treatment methods and understand the microbiome's impact on fertility, paving the way, hopefully, for more effective interventions in the future. Nowadays, vaginal microbiome testing can be done at home by self-swabbing or using a tampon that will be sent to the laboratory for analysis. You can even order these tests yourself online. But if there are issues found, I would recommend you discuss this with your reproductive medicine specialist.